why this the topic was selected was very important, because if you go through any of these injuries, you will find in cricket the chronic injuries, sequelae, is actually chronic injuries account for about total, I would say, acute and chronic as well as the chronic together for about 44%, whereas the acute injuries are the most commonest type of injuries. But even though the chronic injuries, the percentage is very low, because we know the consequences and the repercussions of and also the effects of the players and the team, whereas acute management having, most of them have a standard protocol to be managed. So the hamstring injuries were recognized as the most commonest type, whereas the lumbar stress fractures was recognized as most prevalent injuries in cricketers, especially when it comes to the chronic injuries. So this particular study shows, especially when you are aging, you sustain about 58.7 of the injuries that recurred from the previous sessions. So that's again give us a clue. This particular injury types, are we going to handle the overuse injuries? Are we going to handle the chronic injuries or the recurrent injuries? Because each of these category has its own characteristics, maybe overlapping some of the features. So on top of that, you can see in another under 19 Allied Cup 2013 that is done in India. I think it's 8.3 were recurrent injuries. So having this background, it is important for us to understand about some of the objectives to how we are going to deal with the chronic injuries. The number one is to identify what are the reasons for the chronicity of the injuries. So of course we know the lot of facts, but we have to go for, because it is not the facts that we are going to dealing with the preventive or the causative factors. So what we have to look for about once the injury happened, why it is being chronic. So where the thinking process has to be evaluated. And are we going to have early detection and early intervention? And most important thing is, because early intervention is a kind of a very critical decisions where a lot of factors, co-founded factors are going to be affect on this particular point. And its effect on the players and the team performance, and what are the challenges faced by the medical team and the management team, and strategies to develop evidence-based management module. So this is from Sri Lanka, the 3 sports medicine centers statistics from 2020 July to 2023 July. So you can see the number of cricketing injuries, acute 286, whereas chronic 151, and total it's 437 injuries. So quite a large number of injuries when it comes to the, but the statistics with the international data also more or less same, whereas you can see the most number of injuries count for the hamstrings. Of course other regions are the same, but in the back, pars intercolumnar fractures, degenerative disc disease, facet joint inflammation, and sacroiliac disease also account for a fairly larger number of percentage. So I'll go through few scenarios, 5 scenarios. I'm not going to touch about the pars interarticularis fracture, which has been the the hot topic and the commonest topic, and discussing almost all things. If you really go through this particular injury, this is a chronic injury of a player. He's an all-rounder, and he had 4 years of chronic lower limb injuries, both hamstrings and the quadriceps. So hamstrings including the proximal, middle, distal, everywhere. Because, and the last injury, when we encountered this player, was actually the quadricep injury, where it has a central tendon involvement, and we actually we have done our intervention, because there was a very small period we had to intervene for this particular player. Within 12 days time after this injuries, he has to take part in a major tournament. Of course, we did this intervention for the acute and chronic injury, that is the quadricep tear, with ultrasound guided PRP injection, and also he was put up in the rehabilitation program. So mind you, after this particular session, so what we actually found out was the disproportion of his lower limb versus the trunk ratio, and which is not normal, and also his lower limb cross sectional, that's the size and the strength was very disproportionate compared to the upper limb. So what we did was actually correction of that particular disproportion, and both isometric and the isokinetic strength ratio. I don't know how many of you know about this lower limb to torso, the proportional ratio, because I have done like a lot of research on this particular area, because I will be presenting this particular paper on players, the torso and the lower limb ratio in the global coaches conference in Singapore in late this month. So it is 1-to-1 actually. You can even go up to 1.1 to 1.2, which is the most preference for athletes to prevent certain injuries as well as sustain their performance. So after addressing these things, because since 2019 up to now he did not have any injuries. So the second case is a light fast bowler, again chronic lateral knee pain for 2 years duration, which was actually, when you really go through his profile, he had all these symptoms. There's a chronic lumbar left side ITB tightness, he's a right side bowler, and right side bicipital femoris tendinopathy, that's the lateral side, and iliolumbar ligament tightness, spasms, trigger points, and tensor fascial aorta. So all these times what has happened was, because he was such a fast bowler, he could not concentrate and he could not bowl maintaining his line and length more than 2 overs. It's about maximum 3-4 overs, then he'll get away from his normal rhythm. So this was another case actually. It was undiagnosed lower limb leg length discrepancy, about 1.5, but the normal population, even up to 2 centimeters, it is accepted. But player who bowl about 150 kilometers per hour, so I don't think that any podiatrist or any biomedical scientist will accept that even the 0.5 or the 1.1 centimeters difference. So in this case also, first intervention was the ultrasound guided PRP injection. And then the correction, simple correction, and he has underwent a series of rehabilitation program, which I'm not going to discuss about because I just wanted to highlight certain things. And he got a complete recovery and settled his accuracy and the precision of bowling over the time. So the case scenario 3, actually he's another fast bowler who had multiple degenerative disease mimicking the bilateral recurrent hamstring sprains for 3 years duration. Of course, because of this problem, initially what he has done was he had a hamstring problems. Of course, he was diagnosed having degenerative disease, which is not really the bothering about, because he did not have a single episode of back pain. It was completely 100% the referral pain to the bilateral, because time to time, which has been changing over the years. And you can see the direct evidence of MRI, and it was but problem is, because over the time, with and without physiotherapies and also the professional advisors, he has gone through the excessive strengthening of the bilateral hamstring strength. So I'm going to highlight these things, because why? Because even the elite players, in some instances, when they are suffering from chronic illnesses, they will take their own decisions and engage in particular actions which can be problematic. So this was a case again, because once we identified this cause, our intervention was, the first was actually image intensified, that the CM guidance nerve root injection. And you can see the area where we have injected, and also the multiple areas. So special protocol was done to establish his hamstrings quadricep ratio. Your bringing down is almost 90%, 93% ratio of bring them down to the 70 to 75% hamstrings quadricep ratio, because then he actually engaged in the physical activities but little bit of pain. So there's another case which is a fast bowler. Again, the problematic ankle due to recurrent ankle sprains over the 18 months duration, because he has kind of a full-blown ankle problems. Ultimately, we had to arthroscopically debridement of his sinus tarsi. And the other challenge was actually he had a very non-specific knee joint pain, where you cannot, put it into any of these scenarios. He did not have any osteoarthritic changes, no lumbar bear, no functional anatomy was okay. But what we did was actually we did give them a radio frequency ablation of genicular nerves. So which is a very controversial area. Even though the osteoarthritic patients, extreme cases which is not responding, so we give this. But we make sure that players' symptoms was reduced more than 6 month time. So sometimes the radio frequency ablations, can get the pains up out again after 6 month time, but this case, it was not the case. And again, the podiatry and the sport specific physiotherapy was done, and he's back to his normal, but with limited, tolerance was there. And this is another case of negligence of the ankle injury for 8 months. You can see the junior athlete who has still not fused the growth plates. So this is complete negligence, parental pressure, and the coach pressure, team pressure to continue his bowling, and ultimately end up with the bone marrow edema and multiple ligamental injuries, synovitis, and unfortunately he end up with the complex regional pain syndrome, which actually fulfilled all the Budapest clinical criteria. So, this just 5 cases for you to understand about the complexity of the chronic injuries. So having, make all these facts in a green, the blue color. It could be misdiagnosis, inappropriate therapy, nutritional, strength and conditioning, overtraining, inadequate or biomedical. So these are, the common factors that we know, everybody know about, chronicity of the problem. But when the injuries comes, when it's happened to the chronicity, these 6 reasons was highlighted during this survey. They may be less attracted to the medical attention because of the insidious onset, or the condition may be not notified to the medical team by the player, because they think sometimes it is time and they are fear of that they are losing their position, or maybe some other reasons. And the management pressure situation, players and the team, that is another, because some the pressure situations, they tend to continue playing, because anyway we know that some of their pain threshold is very high. And higher exposure, I don't have to tell you about the the series of events. If you just consider T20, T10, maybe some local tournaments, and maybe the Asia Cup, now it is a World Cup, and they have to fulfill their the other the regular, the yearly calendar tournaments, and everything comes together. And sometimes they return to play with partial recovered injured. Also, because of this, because I think in this area, even I know sometimes in the European, some players tend to get some alternative treatment, maybe the native treatment, where these the therapists which don't have adequate knowledge about the demand and the real things about the sports medicine. So I think this
time is up, Asela.
Nicholas MK, who developed this particular protocol, give us a very good idea about the chronic pain. So I think if you really apply each of these segments to the athletes, I think everything will be depicted what is his going. the reduced activity level, unhelpful belief of thoughts, repeated treatment failures which give him a feeling of depression, helplessness, irritability, and everything. And long-term use of analgesics, which can be a problematic, even VADA, even the side effects and loss of job. I mean, we can consider as a loss of his team position and excessive suffer. On top of that,
Asela,
the current scenario.
I think you're running short of time.
Yeah. Social pressure from the media. So, having to come to conclusion. So this is having you have pain management team, MSK radiologists, everything in line. But remember, but most important thing is to decide where your early intervention has to be done. But unfortunately, this decision is influenced by many other co-founding factors. So, I mean, these are normal, the ordinary things. But what I want to highlight, are we having enough evidence on overall impact and the management of chronic injuries in cricket sports? But you can go through the Google, you can Google and search about this thing, but you will not find a universal protocol to handle the chronic injuries, because it's vary, because it's every, the evidence is case based. So how we are going to manage? So in my conclusion, it is challenge to develop a standard universal management protocol for chronic injuries. So chronic injuries and their nature of complexity should be evaluated with the help of MDT. The decision of interventional therapeutic measures play a critical role, but I would say this is the kind of the golden time or the golden decision where you have to think very carefully, and you should get the multidisciplinary team, especially the team pain management and all these things, and need further studies and publication on management of the chronic injuries. Thank you very much.